give us your sense, from your perspective, what is the right answer about a possible new bill to appropriate money? Right answer for the country and for Minnesota.
Well, both Minnesota and our country are grappling with a massive public health and economic emergency. I've been, even though I'm back in Washington today, I have been hard at work in Minnesota every single day helping Minnesota respond to this crisis. And so now that we are back here, I think our most important job is to continue that work. I am feel very strongly that we need to do the oversight that is our responsibility in Congress. And we can do that through our committee process, and I expect that we'll be doing that remotely. That is certainly my intention. And as we think about how we move forward with additional legislation, certainly at the top of my list is the needs that we have around testing and ample supplies of testing supplies, so that Americans can get the tests that we need so that we can safely reopen our economy and get people back into those who have been working from home or even worse, have been furloughed, can get back to their jobs. And I also think it's important to remember that state and local governments that provide police and fire and transportation and the most basic of fundamental services in this country are going to need help continuing to provide those services and help avoiding the potentially massive layoffs that would happen if the federal government doesn't step in to be a good partner.
So, Senator, let's take each of those in turn. First, with the testing. I know in the last bill that was passed, I think there was $25 billion for testing, another $75 billion for hospitals. Is that the sort of approach, or is appropriations for state and local in part appropriations for testing itself?
Well, I think that there's really two related but separate things. When it comes to testing, we are in Minnesota, for example, we are working to get to 20,000 tests a day, which would be one of the highest, my governor tells me, per capita testing rates of any place in the country. But we're struggling to get there because we can't get the swabs and the other testing supplies that are needed. So what many of us in Congress on the Democratic side want to do is to move legislation forward that would require the president to put into place and fully the Defense Production Act so that the full force of the federal government could be brought to bear on a coordinated response to making sure that states everywhere, including in rural areas, have access to the testing that they're going to need. That, to me, is what we need there as a strong federal response. The other issue is that states have the resources, state and cities and local communities, counties, for example, have the resources to continue to provide the basic services that Americans and Minnesotans count on. And that is going to be falling apart, literally, in just a very short period of time if the federal government doesn't step up.
Well, and Senator, it seems like a wide range of people agree that there has to be some help for the states. Already has been some, but needs to be more. President Trump has said on various occasions he thinks that's appropriate. At the same time, it's become very politically charged in Washington, with Mitch McConnell, the majority leader, saying it's a bailout for the blue states, something like that. If the Republicans do say, we want to appropriate money for the states and the municipalities, but we do want some provision to protect employers against lawsuits if they comply with CDC regulations, why isn't that a reasonable compromise?
Well, first, I really reject the idea that this is some sort of a blue state bailout. First of all, Republican states and Democratic states, red states and blue states are all facing the same kind of budget crisis. And, in my state of Minnesota, before I was in the Senate, I was lieutenant governor and I helped to run the state of Minnesota, and we had a strong budget surplus and a budget reserve. And in fact, Minnesota taxpayers send much more money to the federal government than we get in return. So that's not a bailout by any means. Now, the thing that Mitch McConnell is talking about is just strikes me as sort of the height of politicizing an issue that shouldn't be politicized. Police departments and fire departments shouldn't be politicized. But he's saying essentially in return for helping to support those basic services that all Americans rely on, he wants to let big companies, big corporations off the hook when it comes to keeping their workers safe. And to me, that's not a reasonable bargain at all. If my employer is requiring that in order to keep my job, I work in an environment that isn't safe, where there aren't appropriate safeguards for my health and the health of my family, I don't think that's right. I think that's why we have consumer protection in this country, and we shouldn't be sacrificing it now when people are so concerned about their health. And as a matter of fact, the reason that people will go back to work and will go back out to that restaurant or the local retail store is because they feel that it's safe. So to me, it's counterproductive to roll back safety and consumer standards or to not roll back the protections, right now.
Well, exactly, but Senator, this is not to argue, just to literally understand. I understand we clearly have to have incentives for employers to do everything they can to keep their workers safe. Absolutely, no question about that. But as I understand, the proposal is sort of a safe harbor. If you comply with the CDC guidance, then you cannot be sued. Does that make some sense in an extraordinary circumstance? I mean, if I'm an employer and I do everything the CDC tells me to do, and yet something happens that none of us could have anticipated, should I be sued for that?
Well, I think that my basic view is that we should allow the courts and the way we guarantee justice in this country. I don't understand why we would need to roll that back at this time in our history. I don't think that it's necessary, and I think that it is. What I really think that this is a kind of an opportunity to put forth the reform on liability that I call it reform, but the efforts at rolling back liability protections that have been the kind of the sacred cow of folks for many, many years. And let's not do that right now. Let's focus on what we can do to safely reopen our economy and make sure that we can be funding social services and police and fire. Let's do that right now and not try to get this other thing done.